our choice.
Thank you very much. Again, my name is Zach Kubowski. I'm a nurse with the Whatcom County Health Department. Go ahead.
Would you say your last name again for me?
Kubowski. You can call me Zach. I'm one of the disease investigators. I work in communicable disease. That's the division I work in at the health department. And the diseases we investigate are pretty much any reportable condition. Are you familiar with what reportable conditions are? So it's a list of conditions that each physician, lab, veterinarian has to report to the health department. It could be anywhere from pertussis, measles, chlamydia, gonorrhea, a whole slew of things. So those are the things that I investigate. I have a passion for sexual health, so I love giving presentations on sexually transmitted infections. So I'm very happy to be here. If you get uncomfortable with the word penis,
don't work in healthcare.
you may be the first Kermit. Often, this is a physician's reaction to sexual health. And we have to kind of prod them into asking questions and really asking what the client's needs are. So it's not just the client that may not want to ask the questions, but the physician may not want to ask the questions, which is a huge barrier to getting health services that we need. So this is a pretty packed presentation. I will respect your time. I may skip a couple parts. If you have questions, feel free to ask them during or wait till the end, whatever you prefer. So, sexually transmitted infections. I gave you the first one, but can you name a few others? Herpes. What was that?
HPV.
Yep.
Gonorrhea, HPV. Okay, got a few of them.
HIV, hepatitis C.
HIV, hepatitis C. So we're not going to talk about all of these sexually transmitted infections today, just some of the more common ones and some that I wanted to mention. The first is chlamydia. Chlamydia trachomatis is the name. It's definitely not a flower. I wish it was, but it's not. It is, though, the most common bacterial sexually transmitted infection. It is very common. So we're going to talk just some basics. I'll go through symptoms, testing, treatment, pretty much for each of the infections. I expect you to know a lot of this already, but hopefully there's some of it I can tell you that you don't know. So we'll go through symptoms first. So when you have a sexually transmitted infection, some of the typical symptoms, what do you think you would find in a client? What would they present with?
Pain with urination.
Pain with urination.
Malaise.
Malaise. Is that? Itching.
Yeah.
So those are common symptoms you would find for bacterial infections. Chlamydia and gonorrhea are the two most common, and so they have very similar symptoms. So chlamydia is often asymptomatic, meaning you don't have any symptoms. The majority of people don't know they have it. If you do have symptoms, it could be burning when you pee, kind of a pain. You could have some itching. Men could have testicular swelling and testicular pain. Women can get an infection called pelvic inflammatory disease. So when you have chlamydia, and it goes from the cervix up to the fallopian tubes and their surrounding structures, and those get infected, you could have lower abdominal pain, and that's PID, or pelvic inflammatory disease, which can be actually quite bad in women. Pelvic inflammatory disease, about 10 to 15% of people with chlamydia, women who have chlamydia, will get PID. Of that 10 to 15%, 20 will become infertile, and 30 will have chronic pain. So, although chlamydia is easily treated, it can cause long-term complications. So let's go ahead.
With the pelvic inflammatory disease, does it only come from chlamydia, or you can get it from other?
You can get it from others. Chlamydia is definitely the most common, but gonorrhea as well. And I'll mention that briefly in the next slide. So gonorrhea too. Other complications or other symptoms: conjunctivitis, eye infection, oropharyngeal infection, sore throat, something happened up in here, proctitis, or kind of rectal inflammation. Why do you think you would see those symptoms?
Oral sex?
Oral sex. You can get chlamydia in more than one site. So you can get chlamydia in your throat, you can get chlamydia in your rectum, you can get it
On finger.
not on your finger,
What
but
about around the nail?
No.
We had one tested and.
so you won't get an infection of chlamydia, but what you can do is an auto-inoculation. Basically, you can actually give yourself an eye infection. So it's not an infection on your finger, but you can transmit it by basically putting it in your eye. So really the bottom line for for chlamydia and gonorrhea is that you're testing at the sites where the patient has sex. Not just doing a urine test. If they have oral sex, if they have anal sex, they also need to be tested in those areas. More commonly now, physicians are kind of catching up to that and doing called multi-site testing, so more than just urine or a vaginal swab, which is good. Even at the health department, because sexually transmitted infections are reportable conditions, so we get them reported at the health department. I've seen many cases where we've had someone who had a urine test that was positive for chlamydia, but not gonorrhea. And the same patient also had a throat swab, positive for gonorrhea, but not chlamydia. So you can have them both in different sites. Usually happens when you have multiple partners. Not as common, but it certainly happens. So try to get away from the idea that it's only a urine test or only a vaginal swab. It can be other places. Again, testing. I guess people used to do penile swabs. I don't know why you would do that anymore. You can do a urine test. It's just as effective. I cringe when someone says they got a penile swab for whatever reason. There's no reason for it that I know of.
Well, I don't know about that, because we had a patient who, we didn't get a dirty catch, we got a clean catch, therefore we
Yeah, the only reason is we can't pee. That's a legitimate reason.
I have
But
some
if
in
you
the
can't-
lab if you want.
I'm good. You skip it. Now, a vaginal swab, same deal. If it can't pee, it's convenient. Or if you're doing something else, pap smear or something where it's just easy to collect at that time. Again, you can have rectal swab, oral swab, depending on where you're being tested. Those are usually tests that determine fragments of the bacteria. It says, hey, is this present? But not cultures are not commonly done. So a culture is when you're actually growing out that bacteria in like a petri dish kind of deal. That's not common. Not really recommended unless there's sexual assault involved or you're worried about some type of resistance to the medication. So normally you're not doing cultures, or it's not being ordered. After successful treatment, retest in about 3 months. You don't go the next week and get retested to see if you cleared it. That's not recommended. It's 3 months. And in that 3 months time, as long as there weren't any other accidents that happened, if you're negative, great. If you're positive, again, in 3 months, most likely reinfection, but you can kind of evaluate to see if there's something else going on. Treatment, of course we're not prescribing it, but the treatment for chlamydia, azithromycin 1 gram in a single dose. Pretty easy. You should abstain from sex, not have sex, for 7 days after taking that medication. And that's a good thing to talk to your clients about if they're diagnosed with an STD and getting treated. Don't have sex for 7 days if you're taking the 1 dose. An alternative, and actually it's not an alternative, it is recommended, doxycycline. It's a 7-day course, and you can resume sex after completing it for 7 days. You don't have to wait an additional 7 days, but complete the 7-day course, and then you're good to go. But why do you think I would call it an alternative based on this one?
Compliance.
Yeah.
Was that?
Compliance.
Compliance, exactly. Twice a day for 7 days versus
Right.
one
Yeah.
time.
Yeah.
I can literally watch them take this in front of me, and you're good. Versus they go out, something happens, they don't
Yeah.
finish it. So it disturbs me when physicians prescribe doxy when there's no allergies, no reason why you can't give it azithromycin. Sometimes being kind of proactive for your clients and saying, this isn't no.
On this testing here, is that a standard test that's done with a wellness exam or a pap smear?
Pap smear you generally do get chlamydia gonorrhea testing. and we'll get into a slide a little bit, talking about women get tested more frequently because of it. But there isn't really anything for men. You do a wellness exam, it's not part of it. They may ask you during the wellness exam, but that depends on the provider and how comfortable they are. But unless you specifically ask for it, like my doctor asked me and I said, no, I'm good, but they didn't even question. And they really should question.
I guess where I'm coming at, like health history or age, that sort of thing.
Again, it should be part of it. For like a male, for a man, or someone who identifies as a man, is going to a wellness exam, or anyone really, depending on the age, especially if they're like the 20, 25-year age, the really high risk group, it really should be a part of it, STI testing. But is it all the time? I don't think so. Not much more I can say on it. It should
Because
be.
testing is pretty cheap on this, right?
Yeah.
It doesn't really take much to do the test.
It doesn't, but it's surprising how few providers want to talk about it. So, all I want you to gather from this slide, this is 2016 data nationwide, men on the left, women on the right. You see here, much more common in women to get chlamydia. Why is that? Well, probably because they have annual pap smears, because they get tested more frequently, and they're more willing to go in to get tested. More often, we talk to women who are diagnosed with chlamydia and then treat their partners without testing. So you can give partner medication. You can get free partner medication. If someone's diagnosed with an STD, we can give all their partners free medication.
And partners wouldn't end up on the men's side in that equation?
They wouldn't be tracked because they're never tested. They're a partner of a case, but they were never tested. Now that doesn't explain all of the shifts, but in general we know women are better at getting to the doctor. We can go with that.
I resemble that one.
Yeah, I do too until I ignored mine for a while. Chlamydia life cycle. I'm not going to go through each one. It's a pretty diagram. You can look at it. What you should get out of it is right here. 48 hours is a time basically it takes chlamydia to infect your cells and then for you to be contagious again. So if a client comes, I had sex 2 hours ago and I'm worried about chlamydia, I need a test. That test isn't going to detect anything. And I've had calls saying, I had sex today, and I'm like, well, don't get tested today. Today is not going to detect anything. It does take a little bit of time for that to start getting
Do you
cells.
prophylactically treat for sexual assault? For everything across the board, or do you wait? and
For
test?
sexual assault is a whole different game, but you should definitely test beforehand. And for sexual assault, I believe you want to do cultures.
Right.
And that's more of a legal part of it. Pop quiz. Which one of these is a species for the sexually transmitted infection, chlamydia? Anyone?
A.
Answer is C.
C.
Trichomonas.
I knew it started with the T.
I put this up here. And the problem is, when you get a lab report, it doesn't say chlamydia. It says C. trichomonas, usually. The top 8, trichinosis is a roundworm found when we eat raw meats, typically pork. Trichomonas vaginalis is trichomoniasis, is another type of vaginal infection. The last one I just made up, so that's not that. But I've had people come and say, hey, the client was positive and it starts with the T, and they're trying to tell me what it is, trichinosis, and I'm like, sexual partners for trichinosis? I think we're talking about something else. But a lot of times when you get lab reports, it doesn't say what you're used to seeing. So just be aware when you get lab reports, or if you're just looking at them, I don't know to what level you would be, but I do get calls of people not knowing what the organism is or disease because it doesn't say the common disease disease, it just says the actual bacterial name. Gonorrhea, a lot of this is kind of repeat from the last slide, but I gave you this pretty picture of a drip. Frequently co-infected with chlamydia, so often they go together. Chlamydia and gonorrhea are always tested together when you do a urine test or as well. So it's not like you can just do one. So if someone says, I want testing for gonorrhea, say, well, we're going to do this test. It's for both of them. Why is it called a drip?
There's a discharge.
Yeah, pus from the end of the penis. So, unlike chlamydia, in men, there's almost always symptoms in gonorrhea. And it's usually a purulent discharge from the penis, aka the drip. Women, about 50% are asymptomatic. It can be hard to distinguish between normal vaginal discharge. So unless there's other symptoms accompanying it, it's not as easily identified. But still about 50% asymptomatic in women, but usually symptomatic in men. The main difference between chlamydia and gonorrhea, again, you don't really need to distinguish that because you're doing a test for both. You can have some of the same symptoms, still can have PID, still can get those other infections, eye infections, throat, rectum. Testing, of course, is the same. Treatment is almost the same, except you need ceftriaxone, which is a shot. So you have the pill, the azithromycin pill, plus a shot. So if someone calls and says, I don't know what I was diagnosed with, but I got a shot. Well, probably gonorrhea. There is some gonorrhea resistance, antimicrobial resistance. So that's becoming bigger in the news. It's not really local, but something to be aware of. And also why it's very important that when a client is diagnosed with gonorrhea, that they do get this treatment. If they only get azithromycin and it's more than 3 days, and they haven't got that ceftriaxone, they have to get it all again. There is an alternative, that's 2 oral medications, not recommended, especially if it's a throat or an oropharyngeal infection. The throat infections do not get cleared as easily, and this medication is not very effective at clearing it. And we don't even recommend using this alternative for men who have sex with men at all. But otherwise pretty similar. So, again, men on the left, women on the right. This one this time is more on the men's side. So the rate is actually higher in men for gonorrhea. Why? Well, 50% of women are asymptomatic. Men almost always have symptoms, and that's the one symptom they're probably going to go in for. If you got something dripping from your penis, most men are going to go in for that. Also, it seems to be higher among men who have sex with men. Herpes. There's usually a lot of confusion about herpes. Herpes simplex virus 1, herpes simplex virus 2. I got too fast for you?
Nope.
Okay. You can have, if you've ever had a cold sore, you have herpes. Cold sores is actually herpes simplex virus. Not the same as genital herpes, but the same virus. You can have HSV1 in either place. You can have it HSV1 and HSV2, either one. So it used to be where you say, oh, HSV2 is genital infection, but that's not the case. You can have either one in either spot. You can also, if someone has oral infection, can give it to their partner if they're having oral sex. So you can have an oral infection become a genital infection. HSV2 is generally attributed to have more severe symptoms. So most of the time it's asymptomatic, one of those more sneaky ones. You're not going to have any symptoms. But the symptoms that you might think of are the little ulcers, the rash, you have a bunch of little bumps. That's typically what people think of when they hear genital herpes. You can have them anywhere. You can have some pain and itching too. The first time you have those symptoms, you first notice those little sores and ulcers, that's considered an outbreak. the first outbreak is usually the worst. After that, you may have repeat outbreaks, like it'll heal, go away, and you may have repeat outbreaks, and those are usually less severe. And they're definitely stress-induced, any kind of stress, fatigue, emotional stress, whatever's happening. Testing, now you can do a swab on those sores. That's a recommended test to do. You can do a blood test, which is frequently done. We don't recommend doing a blood test unless you have symptoms. If you don't have symptoms, it's not recommended to get tested. A lot of people go get tested, but they want to get tested for everything. That includes herpes. I'm like, okay, but if you're not having symptoms, I don't recommend it. If you've ever had a cold sore and you get tested and you have one of those that are positive, you're going to be diagnosed with genital herpes, even if you have it or you don't. So unless you've had the symptoms, we don't recommend getting tested for it. But if you have other factors, like you had an exposure to someone, a few other things, you can consider the blood test. Again, wouldn't recommend it, but yeah. Cannot be cured, but you can take oral medications, antiviral medications, to kind of suppress it and keep it at bay. My favorite out of all of them is syphilis. I could talk to you for 2 hours about syphilis.
I was just having.
And bunnies. This is the cutest bunny I could find. I'll put it on that slide for you. This here is actually the bacteria, Treponema pallidum. It is a corkscrew shape. It looks exactly like a corkscrew, like a wine opener. Obviously not that big. They're microscopic. You cannot see them. But that's just the shape of it. Another interesting, so Treponema pallidum is a treponeme. Another treponeme can cause Lyme disease. So Lyme disease is caused by treponeme. And the treatment's actually really similar, although they're different. So syphilis, Treponema pallidum, this is another one. When you see the lab, it's not going to say syphilis. So people call me and say someone has treponema, I don't know how to say it. That's fine. And I'm like, oh, it's syphilis. And bunnies. Bunnies can actually get syphilis. It's not caused by the same bacterium, but it is still syphilis, and it's still sexually transmitted in bunnies. There's another point about bunnies which I'll bring up. And it's a cute picture. So you have a bonus. Syphilis is unlike chlamydia and gonorrhea. It's not what you would expect to see from normal STI symptoms. Syphilis occurs in stages. You don't get the discharge, you don't get the burning when you pee. It's not typical to see in syphilis. There's three primary stages, or three distinct stages that we look at. Primary, secondary, and latent. The first stage of syphilis is a primary. It occurs about 3 weeks after you're in contact with someone else that has an infectious lesion. The first thing that appears is a painless looking sore, usually one. It usually has a rough border, and it's at the site where they're in contact with someone else. So men, typically on the end of the penis. It could be inside the vagina, inside the rectum, in your mouth. It occurs anywhere where it's in contact to mucous membranes or abraded skin. So you could get it on your finger. If you have a cut on your finger and you touch against someone else's lesion, I've seen pictures where that lesion develops on the finger, and you get syphilis just like they did. That sore is really contagious. There's something called ID50, or infectious dose 50, which means it's basically a term that you use, in 50% of people that are exposed to it, this amount will cause an infection. So again, the infectious dose 50 for syphilis is 57 bacteria, meaning 50% of people who are exposed to 57 bacteria will get an infection. Why is that interesting? Because one chancre could have millions around that chancre. Very infectious. If you're exposed to it, you probably will get it. Most people either don't notice that, or it's in an area they can't see. So sometimes that stage is missed. Or the chancre will actually go away on its own. He'll go away. So if you're a guy and you ignored it and it went away and that was your strategy, you're thinking, oh, that worked great. But it didn't go away. That's part of its normal stage. The next stage is a secondary. Happens about 48 weeks afterwards. Well, then you develop a rash. Sometimes that rash is many weeks after that chancre, and you don't even attribute it to being the same thing. A general body rash, usually around the trunk, but also can be on your hands and feet, which is pretty unique. In addition to the rash, you can have swollen lymph nodes around the site where you have that chancre. Condylomata is this flat, wart-like lesion that's also very infectious. Typically, you're going to see them in kind of the genital area or even around the mouth. And those are the two infectious stages. Now, after the secondary stage, you go into latent. You don't have any symptoms. You're not considered infectious any longer either. But it's still inside the person. And that's where it can get kind of crazy. So syphilis, among those three stages, you could have neurosyphilis at any point from infection. Neurosyphilis, basically, the bacteria enters your cerebral spinal fluid. Could be at initial infection, could be days, weeks, years later. That can cause a lot of other things, including ocular syphilis. So it can actually cause blindness and vision problems. It can cause hearing problems. You can even have cardiovascular syphilis, where it causes valve abnormalities. Years later, decades later, if it's untreated, it actually causes deformities on your body. And that doesn't happen really anymore because it's identified early and treated. But the point of this is there are many stages, and it's a very complex bacteria that basically enters every organ in the body within weeks of infection. Symptoms vary quite a bit, but it's very different from chlamydia and gonorrhea. The stages, testing. There is no, you can do a swab, you can do